When a patient is going on their journey to do a consultation,
Yes.
When it comes to the material, if I was to give them a couple questions they should ask at that consultation, number one, what is the material?
Yes.
Right, basically. So they're either probably going to be offered a hybrid or a zirconia option most of the time. That's what we've seen out
Or
there,
something
correct?
worse than both. Like, because some other places actually deliver material, we call it PNMA,
Plastic.
plastic, as a final prosthesis.
You mean, okay, so that's their final delivery versus that just being a try-in for a little while.
We don't even, we use PMA in our work as a temporary or for just to try and.
Right.
Some other places can actually deliver this for the patient as a final.
And two things. One, to clarify, I'm not saying zirconia is bad because we use it. Actually, this ultimate option is zirconia, but we have this combination of materials, okay?
Substrate, yeah.
And then the plastic one is the one we used to, they invented these full arch cases using this type of titanium bars or metal bars with this plastic on top, okay, that we call acrylic. Now we have CAD/CAM technology to be able to make those teeth in plastic and to be able to design those plastic monolithic structures, or adding like bonding two parts, plastic with other frameworks like titanium or different type of things. And that's why, because people is moving away from the complications of monolithic zirconia, so they're looking for options. So that's one of the options, but that's the option we use for temps, for temporaries. We use that option to make temps, to do trials, to do mock-ups. So yes, we use it, and it's very good because we have the digital technology to help us with that, and that's it. But the final product should be in a higher level.
So that, I'll come back to another question, but that first question, they're sitting down at a consultation and they want to know, they want to ask, number one, what material
Yes.
is, and B, if they ask the doctor, do you have anything that has any flex or anything like that, what should alert them to this doctor doesn't know what they're talking about? Or, because again, part of my heart is to help avoid having to go through the expense, the pain, the embarrassment, the frustration over and over again. And so if we can help give an educated consumer and buyer out there the right questions to ask when they're going through that consultation, then that really helps better our field, right? I really believe that. And so I'm trying to think of any other question just on the material side of things that they should ask during the consultation.
I think the most basic one and important is what material and why. Because if your doctor is enough educated, he's going to explain you the differences between materials, he's going to explain you why he's using this material. So he's going to give you something with some background, So I think that's the most important part. Maybe it's not okay for a patient to ask very specific things. Sure. Because the doctor is the one that should know those things. So the most important part is why. So the doctor should be able to explain you and to tell you all the information and to show his knowledge.
Okay.
And then you make decisions based on that.
Okay. Anything to add to that?
When we decided to do this one, we are telling you why we chose this over the zirconia and others.
And it makes sense. Being on that journey with you, I would have never thought to ask until having gone on that zircon journey with you. I would have never known how important some of these things were, and that's why I say, the public doesn't know. They don't know to ask these questions, so that's why I'm just saying, trying to figure out the questions. So perfect. What and why?
Yeah.
Okay.